Hi, I'm Chris. This is a Type 2 Talk. I wanted to talk really quick about there is no one true way, there is no one correct recommendation, there is no one best treatment, because there really isn't. Type 2 diabetes is a disease where your body is not using insulin in the normal, traditional, same efficiency way that a non-diabetic would have. So when you are treating type 2 diabetes, you may need to treat it in different ways, whether that's using metformin, using diet and exercise, using insulin, using Mounjaro, or any of the other, I'm going to call them G medicines, because they all seem to start with G in their generics. They're all different tools that you can use, but there is no one tool that's going to be the best one option for everybody. There is no such thing as the correct recommendation. And not only that, but your treatment that you get will change over time. The best way to help your blood sugars, help your body, will not necessarily be the same now in 5 years and in 10 years. It may change over time as you, your body, your activity, your knowledge of the disease evolves. And also as our medicine evolves. As we get new ways of treating type 2 diabetes, we may get a new option that may work really well for you. So keep that in mind as you're meeting with your doctor, as you're meeting with your friends, and you're talking about it, and you're talking to your family. The foods that you can eat, the methods that you try, even when you eat your food itself, can change over time. So keep that in mind. And be your own best advocate. Your doctor is the person who can prescribe things to you. And certainly, if you think a certain treatment is going to be a really good idea for you, talk to your doctor. And in the end, you need to convince them that it is worth trying that out based on any risk that there may be, and also your ability to accomplish it. Maybe it's something where you have to take this for like 3 months, and you've indicated you're about to lose your job. Well, the doctor's not necessarily going to want to start you on that if they're not confident you're going to be able to complete that, because you're not going to be able to afford the medication, or because you're not going to be on the same insurance or the same coverage, or whatever the case may be. Or if you have tried other things in the past and you have difficulty remembering to take your medication at the same time every day, they may not really want you to start a medication where you need to take it at the same time every day, in the same way, with or without food, etc., etc. They may have those concerns. But then ask them, like, is there a reason why you don't want me to have a CGM? Is there a reason why you don't want me on Mounjaro? Or why you think another option would be better? Talk to your doctor, engage with them so that you understand it better, because in the end, you have to be your own best advocate to your doctor, to your family, to your friends, and honestly, even to yourself. So, wanted to just put that out there, because I've seen some people posting about how, like, oh, this is the best way to treat it, or everybody should just take metformin. Well, not everybody can take metformin. Actually, some people are allergic to it. Some people just react rather badly, and they're like, even with the extended release, they have GI issues. The extended release helps to decrease that, the incidence of that. It does not mean that there is no incidence. It decreases it. Some people simply can't tolerate it, and they have to go with other methods. Some people are going to need insulin right away, and they may actually come off insulin, and then later on in life go back on it as their body ages, and they make less insulin naturally anyways. Your body changes. You're always going to be your own best advocate. Therefore, you should be really learning as much as you can about the disease and how it is affecting you, and how you can measure its effect, so that way you have data. Then now you can go to a doctor, you can go to a nurse or a certified diabetes educator or a registered dietitian and say, hey, I have these data here that show if I do this, this happens. What do I do about that? Or can I do more of it? Or whatever. Or how might this medication affect how these things come out? What might I expect if I start on Ozempic? And this is how things have been the last 3 months. How might they be different in the future? Having that's really critical, because otherwise they're just going to make basic assumptions based on your average everyday person. The thing is, there is no such thing as an average everyday person. We're all unique. We're all different. Be your own best advocate.